Senator Robert Menendez. Senator Menendez, I submitted a letter and want to follow you with this way directly with you. My name is Dr. Maximo Nacer. We have met several times. I am the great-grandson of General Maximo Baez, the man who fought against slavery in Cuba and succeeded. Unfortunately, the situation seems to be that I am placed in a kind of slavery situation myself, because I am a medical certified doctor in the United States since 2001. And since that time, well, I worked 4 years at Columbia University and then was selected to do a residency training, postgraduate training at Lincoln Medical and Mental Health Center. Now, the reality is this is a time of the compassionate agenda. Presidents know best. And I think that we have to retake a little bit of that agenda at this time. I resigned because of the circumstances I was placed are totally unacceptable. Like, for example, some of my patients were exposed to cutting the neck 180 degrees and exposing the patient to psychotropic drugs, probably for the rest of his life, cost for taxpayers, insurance fraud, which is a federal crime, by the way, and all the way to the cost that we pay in our healthcare services. Another lady, pregnant African American, was exposed to drugs that are very highly have a high incidence to produce malformations in the baby. Several patients were exposed to supposed diagnosis of cancer when none of them or many of them didn't have the typical scenario of weight loss, lack of energy, and lack of appetite that characterize the tumor, and calls, medically speaking, for ruling out something else than cancer that leads to death, such as, for example, the infections or things like that. Now, this is 2002, and now we are in 2016. For all this year, I have been exposed to having to survive working in warehouses in New Jersey and say, let me just put a stop on this situation. Let me just reach for the leaders, Cuban American leader, by the way, that has to know about these facts and how we start improving the system. So this is a call for two things. Please help me to get back into my track in the medical field. I'm working now as an enforcement officer at Union City Parking. This is a waste, at least, of human resources. There is nowhere, any place else in the world that we use doctors wasted human resources like this. I mean, what is our moral virtue? What is our integrity to fight against Castro or any other dictator if we are so despicable things in America against the most vulnerable people that are in a bed? So please respectfully request your support. Use me as investigator, if you will, to enforce and to review what is going on in the hospital, to make sure no agency is allowed into the hospital, particularly in these critical times. And use me also to improve the health services. I am more than ready, willing, and able to do so, sir. Thank you very much, and hope to talk to you soon.